Hello, my name is Abel. I'm going to present about electronic health records. Welcome. Electronic health records are computer systems that medical practices use instead of hard papers. It means that the information which were handwritten are now entered in computers for easy access. Electronic health records are used in managing areas around practices, daily operations, such as scheduling, using calendars, making appointments with patients, billing and submission of claims from patients through online forms. Thus, electronic health records are used in managing how institutions are functioning day to day. Now let's see the benefits of electronic health records. First of all, let's see about managing operations. What do electronic health records help in managing daily operations? Electronic health records are very important in scheduling systems because patients can schedule with providers to see whether they can meet at a certain time. There's also documentation of everything which happens because the information which are kept in computers can hardly miss or be lost. There's also billing services because patients are able to receive some bills online instead of going to hospitals and handing each other hard papers. There's also feedback collection because electronic health records enable healthcare providers to create some forms for patients to fill. Also, let's look at chat management. EHRs help in reducing time spent looking for charts or missing information. Also, multiple members can have access on a single document. For example, if I'm going to the hospital and one department wants my information while another also needs it, it is very easy for them to access the same information. While I'm getting what I want, and they can share information as they want. Let's also look at communication. Through EHRs, patients' health records can be accessed from outside office. Also, healthcare providers can easily share responsibilities online, and moreover, practitioners can submit or obtain information from referrals or other hospitals. Now, let's look at the time spent for getting medical services. Through electronic health records, healthcare people can just people can ask and receive lab tests and other information in electronic way. Again, required forms can be filled online. That is very easy and it saves time. Also, electronic health records can be used to reduce errors due to the fact that all information are typed directly to electronic health records, the computer systems. Additionally, electronic health records help in management of chronic diseases by showing care summaries. This makes it easy for healthcare providers and clinical data to see if patients are up to date for recommended preventive services. Now, let's see some drawbacks, because however something can be, things have some drawbacks. Yes, some of drawbacks are financial costs. This is because adoption and implementation costs and ongoing maintenance costs seem to be higher, and it is not every institution that can afford to adopt electronic health records. There's also risks of changes in workflow, because if a hospital is going to acquire some, like, if we are going to acquire the electronic health records, of course there there are some risks of changes, because we are shifting from papers to electronic health records, and it disturbs minds of some employees. There is also loss of productivity in first days, because you cannot see directly the benefits of health electronic health records, unless it passes some weeks, some months, or some years. There's also privacy concerns, due to the fact that hackers can easily go into the database and see some information without permissions. There are also unexpected challenges which may be involved in EHRs, because of course there may be some technical issues, and that is inevitable, if I can say. Now, what are some components of electronic health records that support administrative processes? First of all, there is management improvement. This deals with how all activities in an institution are controlled. Benefits of this component is that electronic health records help in assigning tasks electronically, and they maintain easy connection among employees, and there is tracking patients waiting time, and that the electronic health records help in just saving time, if I can say. Some drawbacks about this is that in case the users of electronic health records are not skilled enough, management of an institution may be difficult, because it requires some skills to make an effective follow-up of what is going on using electronic health records. Another component that supports administrative processes, privacy and security. This component deals with how patients' information are kept private and secured. The benefits include that electronic health records capture privacy notices and consent, like and also electronic health records like record when a patient file is received, and every detail related to the reception of any patient. Again, electronic health records permit you to select parts of the records that each of your staff can use. Also, some users of electronic health records are restricted from viewing some information which are not related to their jobs. Drawbacks of electronic health records. About this issue of privacy and security is that hackers may enter a electronic health records database to see some information without permissions. Another component, or we are moving to the components of electronic health records that support direct, direct clinical data, clinical care. Sorry. The first is prescription of medications and ordering lab tests. This involves getting prescription drugs and lab results easily by using electronic means. Benefits: saving time and saving money for transport. There's also that patients cannot lose their prescriptions because the prescriptions are sent directly to pharmacies. Also, electronic health records help in ordering diagnostic and laboratory test results using computers. The drawbacks of this component is that there might be some misunderstandings of some lab results due to the fact that a person is not present to get full explanations of the results. Another component that supports direct clinical data care, is remote access. This involves how healthcare providers can access full information as needed for emergency. Benefits: a patient does not need to move with files of papers, and instead all information needed to be accessed are easily accessed. That also helps in security of information, because when a person is moving with papers, documents with him or her, there are more risks of using some drawbacks. A patient's information may be used in unwanted ways without the patient's permission. Thank you very much for following this presentation.